I'm going to do collecting a sputum specimen now. So I'm going to check the doctor's orders. We're looking for the type of sputum specimen ordered, because the doctor may order a number of specimens. Usually it's 3 consecutive morning specimens if you're checking for TB. And then sometimes the doctor will be looking for what we call culture sensitivity. And a culture sensitivity meaning they want to culture, find out what bacteria is present so they can give an antibiotic that will counteract that bacterial invasion. So that's why, hence the name culture and sensitivity, and you'll see it as written as sputum CNS. Okay, so we check the doctor's orders, and of course we got our equipment here. We just need a biohazard bag, a specimen cup. We need a pair of gloves. If the patient cannot collect his own sputum specimen and put it in the bag, then we have to have a pair of gloves. We want to have a mouth care device, emesis basin, a tissue, and want to make sure we have some water for the patient's drink. So I got my equipment gathered. I'm going to wash my hands. Get going right in my room. Knock on the door. Nursing! Good afternoon. I'm Mrs. Kyle, and I'm your nurse today. And can you give me your name and date of birth, please? Mr. Pierce, okay. And Mr. Pierce, can you give me your date of birth? 10/3/1960, okay. And you're allergic to penicillin. Okay, Mr. Pierce, what we do, we need to have, you've had quite a cough and you've been coughing some stuff up, so what we need to do is we need to collect a sputum sample for you, and we're going to be sending that to the lab. Do you think you can do some coughing for me? Can you cough pretty strongly? Okay. So what I'm going to do is I'm going to make sure I put the bed up. We're going to have you sitting up in bed, so you make sure you're able to get a good cough in. Now, do you understand how to do the procedure? Okay, you don't? Okay, I will explain it to you. So what we're going to have you do is we're going to have you take a deep breath in through your nose and then out through your mouth. We're going to have you do that one time, and then we're going to have you do it again. And on the third time, you're going to take a deep breath in, and you're going to hold it. And after you go and hold it, what you're going to do is we're going to open it. You're going to open this container. Make sure you don't put the lid top down. And you're going to make sure you do a deep belly cough. Hold your breath for a minute and take a deep belly cough and cough some sputum here. We need about sometimes you have to do it 4 or 5 times. We need about 5 to 10 milliliters in here to be able to send a good sample down to the lab. Okay? And we will make sure you don't touch the inside of the lid with this container. Okay, so before I get started, I'm going to listen to his breath sounds again. I'm going to make sure I clean my stethoscope. And I'm going to, can you take a deep breath in and out for me? Okay. Deep breath again. Okay. Deep breath again. And we're going to be listening under closed, not over closed, because we want to be able to hear what's, instead of hearing closed scratching, when we're actually listening. Right sound. Okay. And okay, and then can you sit forward? Okay, you can. I want to have you take a deep breath in and out. Okay. Deep breath. I'm going to compare both sides to each other. Okay. And we're going to check. Thank you so much. All right. And Mr. Pierce, I'm looking at your we're going to check his respiratory rate as we check his pulse. We don't want him to stop to hold his breath. And again, we're going to check the skin color. I'm looking at skin color, temperature. His color and temperature seem to be okay. And of course, if he was breathing fast, he was breathing like 30 breaths, more than 20 breaths per minute, then we would hold off and delay specimen collection. And then if he can't have the ability to cough and deep breathe, then we're going to have him go and we're going to section the specimen. Okay, Mr. Pierce, have you had anything to eat and drink in the last 1 to 2 hours? Nope? Okay, because we would want to make sure that the food wouldn't come up and you wouldn't aspirate into your lungs. So if they had a tube feeding or if they've just eaten, you're going to wait 1 to 2 hours before you do specimen collection. Okay, so with the bed sitting all the way up, I want you to go ahead and do your thing. I'm going to put over a towel over your system here. Now, do you have any incisions? Okay, what we can do is we can make sure, since your incision, you can put this against your chest and hold this against your chest so you can deep breathe and without having any pain in your chest. Incision. Okay, so we're going to do that, and we're going to hold this right up against your incision. Okay, so I want you to take a deep breath in and out. Okay, another breath in and out. Okay, and you're going to hold this. Okay. On third one, cough. Okay, so we coughed. You put the sputum specimen in this specimen jar, and he went and put the lid back on, and we didn't touch the inside of the lid. And we're going to make sure that I'm going to cover this, and we're going to make sure the patient's name, date, and room number, and the doctor's name, and all the date and time I collected it is on the label, and we're going to put this in a bag, and we're going to send it to lab in 30 minutes. Or if we can't, we're going to refrigerate it, because, again, organisms will start contaminating, and they can grow into the bag, and you can get false positive results. Okay, Mr. Pierce, we told you how to collect the sputum specimen, so you know how, in case we have to do it again, and you did really good taking some deep breaths. You don't want to use mouthwash. We should have cleaned your mouth before you do the specimen, but we don't want to use mouthwash because mouthwash will interfere with the lab results. And you already did the infection. So when we're done, let me look at your respiratory status. Let's check your lung sounds again. Okay. Deep breath. Okay, deep breath again. Again, underneath your clothes. Okay. Thank you for taking a deep breath. All right. And Mr. Pierce, looks like you coughed up sputum that looks like thick and it's yellowish color. That can indicate that you have some infection. And there was a lot of odor to it. And so when we get the specimen results, I'm going to report that to your doctor. And do you have any questions about your test? Okay. And do you feel any pain and anxiety from the procedure? Okay. Good. So Mr. Pierce will lay you back down. Oh, you want to keep your head up? Want to sit up for a while? Oh, you just want to move over a little bit. Okay, that'd be great. Are you having anxiety or any pain or anything like that? How's your head doing? Head better? Okay. And does it help if you splint your incision? Okay, so you're doing fine. Okay. If you need anything, I'm going to make sure I put your call bell here. So if you need anything, you can just give me a call. I'm going to get rid of my equipment here. So you can just push the button if you need anything. We're going to make sure your bed's put all the way back down in position so you won't get hurt and try to fall out of bed or anything. I'm going to make sure I go ahead and wash my hands. And I'm going to report to the nurse that I got the specimen collected and sent down to the lab within the 30-minute time frame. All right. And I'm going to document this. So I'm going to sit here and record in my chart. I'm going to record the date and time the specimen was collected. Okay. And it was sputum for TB, so that's, and then the first sputum, and it was thick, yellow, moderate amount with odor. And patient denies any complaints of pain, anxiety, or shortness of breath at this time. Okay, and I'm going to sign my first initial, last name, SN, and in my case it'll be RN and then CU.